When people think of wartime medical care, they picture morphine, bandages, and field dressings, but one of the most overlooked innovations of World War II came from an entirely different kind of ingenuity. Faced with shattered supply chains, tropical heat, and no refrigeration, military engineers and medics developed a way to create instant cold compresses without ice, a chemical reaction trick that could stop swelling, slow bleeding, and save limbs on the battlefield. This wasn't fancy technology, it was chemistry, pure and practical. In field hospitals and frontline aid stations, where ice was impossible to store and wounds couldn't wait, this discovery became a quiet revolution. It's a piece of survival science that still matters today, and it works just as well in a modern first aid kit as it did in 1943. In World War II, most injuries weren't instantly fatal. They became deadly through shock, swelling, or infection. Medics had to deal with everything from shattered bones to severe burns, and many of those injuries required immediate cooling to prevent tissue damage. Cold compresses were critical for slowing blood flow from open wounds, reducing swelling and inflammation, preventing heat buildup in burns and blisters, controlling fever and heat exhaustion. But the problem was simple. There was no ice. In desert, jungle, or frontline conditions, refrigeration was a luxury no one could afford. Even in established medical units, ice melted fast and dry ice was dangerous and impractical to store. So engineers and chemists went to work creating a way to generate cold on demand. No freezer, no icebox, no electricity. The solution came from an elegant principle of thermodynamics, endothermic reaction, a process where certain chemicals absorb heat from their surroundings as they dissolve in water. The team behind it worked on basic compounds that could be found cheaply and produced in bulk. Eventually they settled on ammonium nitrate and ammonium chloride, common agricultural and industrial salts. When these were mixed with water, the reaction drew in heat, dropping the temperature dramatically, often by 20 degrees Celsius or more in seconds. In practical terms, mix the powder with water and the liquid gets icy cold. That meant medics could carry dry packets of the chemical and mix them on the spot to create a cold compress instantly, anywhere in the world. By 1943, field manuals for both Allied and Axis forces included notes about this instant ice method. It became part of field dressing kits, especially among engineers and medics working in the Pacific and North Africa. When ammonium nitrate or similar salts dissolve in water, they require energy to break apart their ionic bonds. That energy comes from heat, and they pull it directly from the surrounding environment. The result? The water's temperature drops rapidly, creating a cooling effect powerful enough to numb skin and constrict blood vessels. To stabilize the effect and prevent frostbite, soldiers usually wrap the mixture in cloth or gauze before applying it to a wound. In some field improvisations, the cold mix was poured into rubber gloves or canteen covers to create makeshift ice packs. This wasn't a luxury, it was triage science. Cooling a wound quickly could mean the difference between keeping a limb or losing it to gangrene. Even when chemical packs weren't available, medics improvised. Reports from the Burma campaign and the North African front describe soldiers mixing salt and ammonium bicarbonate, or even urea fertilizer and water, to generate smaller-scale cooling effects. When resources were scarce, military medics learned to scavenge from what they had. Bomb disposal teams carried ammonium nitrate for demolitions, while mechanics often had glycerin and alcohol. Combined properly, they could trigger similar temperature drops. This field improvisation wasn't standardized but showed how widespread the knowledge had become. Soldiers knew the basics of heat absorption and used it to their advantage. Chemistry turned into survival. If you've ever cracked an instant cold pack from a first aid kit, you've used the same World War II technology. The packs work on the same principle. 2 chambers separated by a thin barrier, one filled with water, the other with ammonium nitrate, or calcium ammonium nitrate, in the modern, safer versions. When squeezed, the barrier breaks, the contents mix, and the reaction instantly cools the liquid. What began as a battlefield necessity became a global medical standard. By the 1950s, hospitals and athletic trainers were using chemical cold packs, and by the 1970s, they were mass-produced for civilian use. Today, they're found in almost every emergency kit, but few realize their origin lies in wartime chemistry. For survivalists, medics, and field researchers, this forgotten trick is still one of the most useful low-tech cooling methods around. It's entirely self-contained, lightweight, and requires no power, ideal for expeditions, remote camps, or emergency kits. You can buy modern, safe equivalents that use urea or calcium ammonium nitrate instead of pure ammonium nitrate, which is now restricted in many regions. These are stable, non-toxic, and long-lasting. They function the same way. Just squeeze to break the inner pouch and shake gently to mix. Within seconds, you'll have a cold compress ready for first aid. If you ever find yourself without one, the World War II mindset still applies. Understand the principle, not just the product. Cooling can also be achieved through evaporative techniques, wrapping wet cloths around limbs and fanning, or burying liquid containers in damp earth to encourage heat loss. The soldiers of World War II mastered the science of making do, and that mindset is just as valuable as the chemistry itself. This little-known invention is a perfect example of how necessity drives innovation. The cold pack didn't come from a lab in peacetime luxury. It was born from wounded men lying in jungle mud with no ice for miles. It reminds us that even in chaos, knowledge is the ultimate survival tool. The next time you grab an instant cold pack, remember, its history began in a foxhole. It's a fragment of World War II ingenuity, a moment where field engineers turned chemical theory into life-saving practice. If you value learning the practical science behind forgotten military innovations, subscribe to Strange History and share this video with a friend who loves historical survival skills. These aren't just stories. They're lessons worth keeping alive.